Okay, now we're recording. Okay,
Okay.
can you see my presentation?
I see your presentation with my screen on top.
Okay.
There, now it's gone. Now I see your presentation.
Okay. So, hello, thank you for joining me for my presentation. My presentation is over my oral health social media campaign. So for this presentation, we're going to define the public health issue, define my audience for this campaign, the objectives of the campaign, my strategy, the technology, the social media platforms that I'll be using, and the pros and cons of those social medias, the plan, how I will evaluate that plan and evaluate the campaign, and then my suggestions for the future of this campaign. So defining the issues. So to start off, I work for a dental school here in Missouri, and so I thought one of the better issues that I could tackle was oral health, and so I wanted to address oral health and providing proper education and uh, prevention for caries for the St. Louis metro area via social media campaign. And so my target audience for this campaign was the parents of children younger than 15 years old living in the St. Louis metro, and then young adults ages 16 to 27 living in the St. Louis metro, and adults with type 2 diabetes. The objectives of this campaign are to provide oral health care education, encourage proper oral health care routines, and reinforce oral health care messages. So here is kind of the outline of the strategy, which are some of the objectives for the campaign. So by December of 2019, there would be 100 new Twitter followers on the Oral Health Education Twitter account. There will be 5 social media posts for the Oral Health Education campaign on Twitter and Pinterest. And there will also be 25 post shares from the Oral Health Education campaign Twitter followers. So, as kind of mentioned before, the social media platforms that we will be using are Twitter and Pinterest. This is because 42% of social media users use Twitter, and one of our target audiences, which is usually the mother, the responsible party for a child, is our mothers, which are using Pinterest. So, the pros and cons of the social media platforms that were chosen. So the pros of Twitter is that it's really easy to use. It has the power of the hashtag. So you can use the hashtag to garner interest in your campaign, have people kind of search for your campaign, or even if you just use the hashtag, if they're not looking for your campaign specifically, they can find information about what you're trying to convey. And then you kind of get to the point, short and easy. There's only 140 characters available, so you really have to be concise about what you're trying to say. For the analytics for Twitter, you can really measure your impact on Twitter and how many people you're reaching with your posts. And then the automation also makes Twitter very user-friendly platform to use because you can actually pre-schedule your posts so you don't have to update every single day. You can pre-schedule those to go out at any time that you want them to. So some of the cons of Twitter though are kind of the spam of Twitter. So there's a lot happening, which kind of ties into bullet number 2. Twitter is very busy. So again, there's a lot happening on Twitter, and users have to filter through what's really important, what they really want to see. So a campaign like this kind of has to battle back against the spam and battle back against the hashtags that aren't appropriate for these presentations. And that's kind of one of the cons because there's just so many people using it and so many hashtags and so many campaigns going on. So I mentioned that one of the pros is the 140 character limit. One of the cons is actually the same thing, the 140 character limit. So if there's a lot that you want to say, Twitter isn't necessarily the best platform for that because you have to be so concise. And so sometimes when you're trying to be so concise, it could misconstrue what you're actually trying to convey in your campaign. And then also the quick response. So in a way that's a pro because you can respond quickly to your followers, but also that's a con because your followers expect you to respond quickly. So if you don't, that can harm your campaign because it appears that you're not communicating with your followers or for the people who are interested in your campaign. So some of the pros and cons of Pinterest. So some of the pros are that it has a lot of high traffic. Again, a lot of parents use this, especially moms. It does have a built-in search engine optimization feature, so users can just search what they want to look for, and it automatically pops up. So if you type in oral health, the campaign would automatically pop up. It is visually driven, so any of the graphics and any of the things that you post that aren't words necessarily will be presented up front on Pinterest, whereas on Twitter, that wouldn't necessarily be the driving force. And people tend to think in pictures, so using Pinterest for that is really great. And then again, the female market, as mentioned previously. So Pinterest is comprised 65% of women, and then it's 85% of the traffic is to Pinterest is driven by women. So that's a con and a pro, because while it's great that there are a lot of women on there, and they're usually the ones that are taking care of the children and need the education about oral health, they aren't the only ones. And there are fathers that use Pinterest, and but there aren't many. And so if you want to get to the fathers or get to the men, Pinterest may not be the platform that you want to use yet. And then the other con about Pinterest is that it's really only for fun, so people aren't using Pinterest for health reasons yet. It's going more towards that way, but it isn't the top social media platform for health information. So defining the plan. So we define the communication campaign goals. So we're going to promote oral health care and provide education about oral health with the audiences in the St. Louis Metro. The audiences are the parents of children younger than 15, and then young adults 16 to 27, and adults with diabetes type 2 living in the St. Louis Metro. Again, the messages are the 5 social media campaign posts on Twitter and Pinterest, and the 25 shares on Twitter. And then just to pre-test and revise those messages and materials, you want to utilize the community toolbox and also make your SMART objectives fit those goals within your Pinterest and your Twitter posts. And then finally, implementing the campaign. So this is some of the strategies and way to implement the campaign. So we'll use Twitter, we'll use Pinterest. We're also going to utilize some partnerships with the Missouri School of Dentistry and Oral Health, so they can provide content for the social media account, so that what is being posted for the social media campaign isn't just fluff. It isn't just, hey, go brush your teeth. It's actual information and actual health related information about oral health that really matters and that people really need to know. And it's based off of research that's being done. And also within Mosdo, having that partnership, we also have an ATSU partnership that ATSU and Mosdo can be sharing those posts. And then the Missouri Area Health Education Center actually has a regional office in the St. Louis area. And so they can actually use our posts and share our posts and tag important influential gatekeepers within the St. Louis area, like well-known dentists and well-known other oral health care educators within that St. Louis area. So to evaluate, you really want to have your objectives well defined, and then define what success means for those objectives. So for the first objective, the success for that is that there are 100 new Twitter followers for the account by December 31st. And then the second objective, the success for that is that there are 5 social media posts for the account on each social media platform for a total of 15 posts by December 31st. And then the third definition of success is that there are 25 post shares of the account from campaign followers. So not just Mosdo and not just ATSU and not just MAHEC, but other followers, individual accounts. So then an evaluation plan, it's really important to have descriptions of who's going to be responsible for this. So we would have an oral health education coordinator who would be responsible for the implementation of the campaign. Deciding what to measure, we would actually want to measure the success of the campaign objectives, which are to the left. Choosing a method of obtaining data, the coordinator would actually go and log in and use the analytics that are provided within Twitter and even Pinterest to determine if those objectives are being met. And then to schedule that, we would want to know and have numbers and data by February 1st of 2020 to know specifically if our campaign is running smoothly and what we could reevaluate and revisit and repost and redo to have a better flowing campaign. So these are my suggestions for future plans. We would hire the actual oral health education coordinator, develop more campaign posts with field expertise, as I was mentioning with Mosdo. We would actually meet with MAHEC to establish a social media partnership, and we would meet with Mosdo to establish a social media partnership. So it's one thing to follow Mosdo, it's one thing to follow MAHEC and hope that they're going to share our things, but it's another thing to actually meet with them and have an understanding and maybe a written contract that says we will share each other's content so many times a month. And so that would be something that I really suggest, that we have something written out so we know that that has to be done and not just kind of hope that it gets done. And these are my references. Do you have any questions?
Yeah, you said you would have a coordinator for posting and analyzing all of the analytic data. How often would the coordinator do a review of the analytics?
So the coordinator would actually be their sole job. Their 40 hours a week would be this campaign, and we would ask that they run the analytics at least once a week so that we can see how well we've done that week, at least initially, since it would be a brand new campaign. It would be the pilot of the campaign, and then as we go forward, maybe making that every 2 weeks and then every month. But I would never say over a month. We would always want to have it ran at least once a month, but initially during the pilot, every single week we would want it ran for sure.
Is it possible for anybody other than the coordinator to see the analytics?
Yeah, so the coordinator would actually run the analytics and then have a report ready for the oral health campaign manager, and then kind of work with the oral health campaign manager and then the kind of the stakeholders who would be like Mosdo and the partnerships within St. Louis, which would be like the health clinics and different things like that. So they would share that information with them so that they could get feedback on how better to implement the program.
So the decisions that they make after they review the analytics would not be the sole responsibility of the coordinator. That would be communicated to the other participants, and then they would decide together how to modify?
Correct. Yes.
Gotcha.
Yes.
Sounds good to me.
Okay, thank you so much. I so appreciate it. Thank you.
Bye-bye.